Hi, this is Rich Sanders, and this is the Health Law News Nugget for February 13, 2018. It was a busy week in Washington last week, but for our subscribers who watch the News Nugget every week, the most important thing that happened last week that affects the healthcare industry is the release by the Council of Economic Advisors at the White House of a paper discussing biopharmaceutical pricing last week. The paper mentioned two specific goals for federal policy going forward. The first is decrease in drug prices that all Americans pay, and then second, the much broader goal of a decrease in healthcare costs generally, both through the adoption of new, more advanced drugs and innovation in healthcare. The Council of Economic Advisors, which is a group of academicians, economists, and others that the president assembles for advice on economic affairs, specifically pointed to a wide range of potential reforms while not offering any specific or concrete details on what the president will ultimately do with these recommendations. They included things like changing Medicare compensation to physicians to remove the component where physicians purchase drugs in advance, folding Medicare Part B drug benefits into Medicare Part D drug benefits. On the Medicaid side, ultimately acknowledging that Medicaid agencies have a difficult time buying drugs and getting the economies of scale that are available in other areas, allowing Medicaid agencies to pool into groups of 5 states or less to deal with drug companies and get a better pricing rate. And then finally, proposing that the FDA fast-track brand name drugs to decrease the costs of moving those pharmaceuticals to market. Specifically though, pharmaceuticals industry representatives reported that they were pleased with the report from the Council of Economic Advisors because despite all the rhetoric from 2017 regarding setting prices, decreasing prices through increased regulation, and increased price transparency, the pharmaceutical companies were not mentioned specifically in this report as a cause inherently for the increased drug prices, and more importantly for pharma companies, the report did not include any recommendations of government price setting for pharmaceuticals going forward. So for those of you who are on the provider side, there could be changes coming as a result of this report on compensation for physicians or hospitals under Medicare Part B. Could be for those of you who are Medicare enrollees or related to Medicare enrollees, could be changes to prescription drug benefit under Medicare Part D. And for all of us, ultimately, potentially some decreased costs. We'll just have to keep an eye peeled on what comes next as a result of this report. Thanks for watching, and we look forward to seeing you again next week with another Health Law News Nugget.